Hello, all, and welcome to the Caregiver Support Series. So, this week I'm going to start by saying sit back with your favorite cold beverage, and as always, feel free to reach out with questions or topic requests. I hope you are all thriving and surviving in this heat. Today, we will be talking about palliative care, and we have our second very special guest speaker, Katie Williford. Katie is our Vice President of Business Development and oversees our Sincera Palliative Care program. She's a strong leader and an admirable coworker. I know you will appreciate what she has to say. I'm so excited to have Katie take over our first segment and talk about which words she feels describes palliative care. The Education Corner is going to focus on goals of care conversations, and there is additional related content at the end of the episode. Next week, I will talk about the natural dying process. When I asked Katie to be a guest host, I gave her 3 prompt questions to get her started. I asked her what she thought were the top 3 words to describe palliative care, what was the one thing she wished people knew about palliative care that they may not, and how has working in palliative care changed her? So welcome, Katie.
Hi, Sarah. Thank you so much for having me. Um, I would have to say that if I could pick 3 words that I would identify palliative care, one would be symptom management. The next word or words, it's really a phrase, would be goals of care. And then the third would be wellness. I know it probably sounds funny thinking that wellness describes palliative care, but you really cannot talk about palliative care and serious illness without talking about wellness first. Because the whole purpose of palliative care is to help you and your family and whoever's caring for you live well in the face of serious illness. And, that is a concept that I think is hard to grasp, but once you flip it and look at it as, I really can, it is possible for me to live well. um, it really does fit. If I could pick one thing that people knew about palliative care, there's so many, it's hard to pick just one, but I would have to say I wish people knew that palliative care really is designed to, again, I'm just going to say it again, live well in the face of serious illness. You do not have to choose between treatment or quality of life. You can actually focus on both. And the main thing that our clinicians are very skilled in and working with our interdisciplinary team um, is helping you really navigate those different choice and decision points of your illness, whether it's to add medication or whether it's to um, maybe you need to decrease your hours at work or, whatever the case may be. Um, you don't have to choose. You can focus on both. And I would have to say, in thinking about, you really can't work in palliative care and not have your life changed, whether you're an administrator or a clinician or you're the administrative assistant. You can't really work in this environment and not be changed. And I would have to say, I've just been changed immensely and have looked at life so differently um, in looking at, okay, if we're trying to help our clients live well in the face of serious illness, can I really say honestly, am I living well? Right now as a healthy person. And so, with palliative care, we're looking at not just the physical self, but we're looking at your emotional self, your spiritual self. Um, how does your culture and your beliefs and your personal beliefs affect your decision making and what you want for your life? Um, and so I would say as a healthy person, I'm not all there on each one of those levels, and it's helped me look at my life and say, if I did get sick, what areas would I struggle with? Because I feel like the stronger you are in each one of those areas, the more successful you're going to be when the bridge kind of falls apart. And so, in having a social worker, having a spiritual caregiver or chaplain, better known as a chaplain, having our nurse practitioners, all of those team members are really skilled in each one of those areas. And so not only are we addressing the physical symptoms, but we're also addressing the burdens that come along with having a serious illness and the emotions and the loss that comes with having a serious illness, the loss of identity, the loss of who I was yesterday, the loss of the fact that I feel too ill to go to my son's soccer game. When we're feeling bad physically, it's hard to really even go to those places. But I would have to say that once we can handle your physical symptoms, we start digging deeper. So as I relate that back to myself, I really feel like, I want all of those areas to be strong in the event I would have to face something like cancer or COPD or CHF that really drastically changes how you live. So, well, I really appreciate you having me. I hope this was helpful, and I hope whoever's listening, this was helpful as well. You can contact Sincera and ask any questions at any time or make a referral at 419-931-3440. Thank you, Sarah.
Thanks so much for that, Katie. Personally, one of my favorite things about palliative care is that time is built into a visit to talk. Clinicians understand that talking about goals of care is the pivotal communication task. It has been proven that when clinicians are able to communicate effectively, their patients retain more information, have higher trust in them, and ultimately can have better quality of life. Think about when you go see your primary care provider or even a specialist. You have a pretty limited amount of time to talk about what's going on and ask questions. And if you're not totally comfortable with that clinician, you may be hesitant to ask anything at all. When a person is dealing with a serious illness, they can feel easily overwhelmed by the amount of information they are receiving. Palliative care clinicians are trained to have those difficult conversations that lead to providing care that aligns with the patient's values and goals. Effective communication and discussing goals of care has led to better outcomes and more meaning for both the patient and their clinician. My nurse tip for you this week really does surround that feeling of being overwhelmed when somebody is facing a serious illness. Because of that, patients can miss or misunderstand key information or forget to ask questions. I always encourage patients to have their person with them during visits, that one person that they trust, who can advocate for them, who's consistent, and who can come to listen, really listen. Listen to the clinician and listen to the patient. Ask more questions, provide support, help the rest of the patient's family and friends understand what's going on and what the patient really wants. Effective communication is a skill that takes practice, but can have such an impact on the entire experience, not only for the patient and their person, but for the clinician as well. This is one of my favorite videos by one of my favorite palliative care clinicians, Dr. B.J. Miller. If you are not familiar with him, check out this 3-minute video and then watch his TED Talk. I highly recommend it. Thanks for watching. This has been an episode of the Caregiver Support Series brought to you by Hospice of Northwest Ohio. Next week's topic is the natural dying process.